Good morning, everyone. We'll get started in just a couple of minutes. As a reminder, we do have to deny access to any AI that are not state approved, which would be Gemini and ChatGPT. The meeting will be recorded. I will mention that again. And Gemini will be taking notes that will be available. And we also have the fabulous Beth Bretterman with us this morning that takes care of keeping all of us coordinated and sure that we're able to keep track of that. Can other people hear me?
Yeah, we can hear you.
Okay, Shelly, it might be yours. You might have to go out and come back in. Oh, okay, good. Okay, we'll get started in about a minute. Thanks. Okay, good morning, everybody. We are going to go ahead and get started about on time today. I know that a lot of people have plans, they have things they want to do. A lot of folks are already out on vacation. So we're just going to go ahead and start rolling this morning. Hopefully we don't have too long of a meeting today. So there's only a couple of things on the agenda. I'll go ahead and get that pulled up. But just as a reminder, these meetings are recorded. They are also posted on the Garrett County Health Department website at garretthealth.org. And Jim and I will be taking notes. And we have the fabulous Beth Bretterman with us this morning that makes sure that this meeting even happens. But also takes care of all of our minutes and keeping track of everything to just make sure that we're able to keep moving forward. So I'm going to go ahead and pull up the agenda here this morning. Give me just a second. Okay, and can someone just let me know if you can see the agenda?
Yes.
Okay. Thank you very much. Okay, so once again, I just want to remind everybody that we are still doing presentation series overview and request for presenters. So I just want to keep this open to anybody who is interested and sort of has a topic that they want to present on that is related to child or adolescent health. It could be based on data, it could be based on programs, systems, whatever it may be, as long as it's really focused and geared toward the promotion of health for children and or families. So last month we had Autumn come and talk about cancer control programs in Garrett County, which are also really critically important and kind of span multiple populations. But I just want to keep that open. If you want to present, please email myself or Beth Bretterman. We are starting to fill up a couple of additional presentations for the fall. I'm hoping to get some folks come and talk about resource coordination. We are also in the process of updating some of the data on the resource guide. And one of the things that I think is an underlying current is that there is an increase in the amount of resources that are needed. So we are tracking that data, and hopefully we'll have some presentations on that in the future. But I just want to keep this open for anybody who wants to come and present on a topic. It's a really great way for us to have a recording of that we can then share with health department staff, other agency staff, and then just the community at large. So that is open. Please email myself, john.corbin@maryland.gov. I'll put my email in the chat, or Beth Bretterman, and we will try to get you on the schedule if it aligns with the focus of this work group. So the first presentation this morning is super exciting. It's one of the big projects that have been happening here over the last couple of months, and is continuing to sort of hit the ground running. So Shelly Argabright is with us this morning. She is the Chief Health Strategist at the Garrett County Health Department, and she is going to give us an update this morning on 360 Access Hub, which is also known originally as the Garrett County Food Bank Project. So I'm going to go ahead and stop screen sharing here and just kick it over to Shelly.
Good morning, everyone. Can you hear me all right? All right,
Yes.
Wonderful. So we're pretty excited. Just wanted to give everyone a brief update about the 360 Access Hub. This project has been kind of started in October, and I see that Lorena joined the call. So Lorena is from Maryland Physicians Care, and she was just trying to coordinate with us. And thanks, Amber, about trying to put something together. So the stars aligned. Chris Mullet from Community Action had a physical space, and that's at 360 West Liberty. And so we partnered, and the three of us have basically began this 360 Access Hub, which is designed for basically people to be centered and come for food and then get resources, so get connected with other community support services. And basically just a few, I guess it was on the 27th of June, we had our first soft launch where we, with Maryland Physicians Care, they have what's called a social risk factor score. Lorena may be able to talk a little bit about that later on in the meeting, but they identify high-risk individuals, and we were able to utilize Maryland Physicians Care to schedule appointments for this first day. We did get some seed money from the local management board to stock the pantry, and we were able to, I don't know if John, you can pull it up or not, but I basically created recipes, and we had a shopping list. We put together a point of sale website so that we could track inventory, and we just wanted to kind of test the waters. And so we served 10 families on the 27th of June, and it went pretty smooth. There were some bumps, and we were glad that we were able to just kind of work through that. We had a coordinator from Maryland Physicians Care who did a screener with everyone. We also used a life scale assessment to kind of gauge where people are at with different domains in their life. Thanks for pulling that up. This is just the shopping list that people were able to go down through. We had recipes that corresponded with the things on the shopping list that were quick and easy that people could choose from. We are making sure that we have a client choice model, so we're not being prescriptive in what people have to choose. They can choose what's best for them. This is a little sneak peek into the point of sale system on the back end. So when people are shopping, basically put it in your cart digitally. And that was pretty exciting for us. So it's been a long time coming, and just a lot of discussion about it and how we were going to set it up. So we do have that initial pantry stocking and some material there for the initial soft launch. And so we are building out the website. Actually today we are working with Community Works, and there are, I think, 11 or 12 volunteers that are painting and finishing up sort of the aesthetic inside of the 360 Access Hub, and so that it can be ready for just our next distribution, which I believe is going to be July 22nd with Maryland Physicians Care. So there's a couple different funding sources and a couple different ways that we are trying to, I guess, just run the food resource hub. And so one of those, in addition to Maryland Physicians Care, is Care First Blue Cross Blue Shield. So we got a grant, a competitive grant, and it's basically to create better food systems. And so we're looking at various levels of how to coordinate and address food insecurity. And our particular piece of that is working specifically with physicians. So when you go to the 360 Access Hub website, there will be an enrollment page. And so one of the ways you can be enrolled to be served at 360 Access Hub is through your physician. And so that is through that BASE, we call it BASE. It's Bridging Appalachian Systems Equitably, that grant. And the providers, any provider can join. It's pretty similar to what we heard last month about Autumn. So it's a simple form. Providers can opt in and have a place where they can actually send patients who they feel need services at the Food Access Hub. So we understand that a lot of different providers are screen and use different tools. And so this is going to be part of this process is going to be what's working best. We're trying to create this referral system. And so we're asking physicians and providers how they want that information to come back to them. so that we can try to really begin to build relationships and work with people who are food insecure and put them on a pathways program to see what some of their other needs are. So that's just a real brief general overview, but since I have a couple providers on the call, it would be great if we have the time just to hear a little bit about the way that you all screen for food insecurity, if you do, and if you have a process in your office. If something like this sounds appealing, if it's something that you feel is needed, we do have data to support that it is needed in our community, but just to hear from you all this morning would be wonderful. So I'm going to stop talking and open it up to questions and just other further discussion about how people identify clients and patients that are food insecure in our community.
Julia, this is Sotiris Stavopoulos at Cornerstone. A lot of this we probably do more so at the annual wellness visit for Medicare patients. Probably less so in other areas. So I'd be interested in hearing about some, even having you come to the office to speak with the four providers to talk about some of the screenings that you have available.
Okay.
We can improve that. But
thank you. So right now there's a couple different screening tools that are evidence-based. The American Academy of Pediatrics joined with the Food Research Action Center, and they have a pretty robust toolkit. We actually it's a 2-question screener, and that is on our garrettcountyfood.com website. We launched it in preparation for this base grant. It took almost a year to get approved, and we were kind of preemptively hoping we were going to receive the money. So we built some things out ahead of time. And it's a very basic screener. Like I said, it's 2 questions. Number 1 is, within the past 12 months, we worried whether our food would run out before we got money to buy more. And the second question is, if within the past 12 months, the food we bought just didn't last and we didn't have enough money to get more. And it's a 4 scale. So it's often true, sometimes true, never true, and don't know or refused. In addition to just the basic screener, the toolkit is very comprehensive as far as just digging into all the different aspects of shame, of just things and experiences people go through. There's quite a fear of just a report to like Child Protective Services and things like that when people and parents aren't able to provide food for their children, as one example. And so in the toolkit, there's all kinds of different ways that they recommend broaching the subject and talking through some of these nuanced, really sensitive topics. And so part of the problem that we've kind of run into, we have all this national data, and we have data that supports people are food insecure. We run programs where we run out within hours, but we don't actually know how much food insecurity is here and at what levels that is. And so we have people that are on all sorts of federal assistance. That's all changing, as we know, and there's a lot of uncertainty. And so a program like this, where people can be referred, they can come in. At 360 Access Hub, we refer to every client as a guest. We want to make them feel very welcome. We're training all of our coordinators to be trained with dignity training and really support of the person coming through. And the registration, we call it a registration. It's not an intake form. And so we're trying something that's a little bit different as it relates to just lifting the person up and making sure that we try to reduce as much fear as possible. And so the other question, because these are 12 months out, there's another evidence-based survey. It's called the Survey of Wellbeing in Young Children. And so it's more specific. It just says, in the past month, was there any day when you or anyone in your family went hungry because you did not have enough money for food. And so I think it's just going to be a little bit of trial and error as we start the process and figuring out, trying to make it streamlined so that it's not a lot of work on the provider offices. It's not a lot of work at the registration 60 Access Hub, and people can really begin to, follow, just not lose people in the referral process. So there's a lot of different, I'll get to you in just a second, Lorena. There's a lot of different, I guess, requirements tied to all the different pockets of money that we're trying to utilize to build the 360 Access Hub, and everyone has significant requirements. That's just it, right? And so we have to ensure that we're kind of crossing all those boxes and trying not to trip over one another. And this concept of just screening in general, everyone uses something slightly different. And so the screening just generally is a different topic than the actual food insecurity questions. It could be part of it, but just so we kind of clarify that. So Tier?
Sorry. So they will not have to have, because it sounds like Maryland Physician Care has been helpful with all this. They do not have to have Maryland Physician Care, correct, to do this, because I think some of the people that fall through the cracks are those who, don't qualify for assistance, any assistance, but are, just making it. So they don't have to have Maryland Physician Care to be able to be referred to you, correct?
That is correct. Maryland Physicians Care is a key founder and a key player, and we want everyone that comes through the 360 Access Hub to make sure that they are insured. So part of that is part of that client process, and just, I guess, just taking care of all their needs. We're going to ask those questions, and everyone who is, we want people to be provided for. But yeah. Maryland Physicians Care,
private, they'll have private insurance and still not be able to have enough for, So
we have a certain amount of money set aside through this base funding for providers, and it's not specific. They don't have to be a Maryland Physicians Care member to utilize it. And then Community Action is the designated emergency food agency. And so they will have a certain portion of money also to help all of the people that fall in between and fall through all the cracks. Obviously, there's only so much money. And so as we're starting the process, we have to be just mindful of that. We have to make sure our costing works. We have to make sure that we don't run out of food in the pantry. And so the sustainability models and all the food drives and the donations and all of those things will start to ramp up here with other partners. But right now there are 3 options. So there's Maryland Physicians Care. That's one way to enroll. There is, and that's with, and I'll let Lorena talk all about that. There is my funding, which is base funding through the providers. And then there's Community Action. So Lorena, do you want to talk a little bit about your role in Maryland Physicians Care members at the 360 Access Hub?
Well, sure. Happy to. Thank you, Shelley, for the opportunity. And as Shelley mentioned, we are very humbled to be at the table and be part of this initiative. This is really being driven by the health department, as well as the Community Action Committee and the local management board. We're here to support in any way we can the community. Back to the question about Maryland Physicians Care, we have done partnerships like this in many different counties, including Baltimore City, where we have a strong allegiance with the Food Project, which is truly a centralized food hub. It's actually a social care hub with everything from a daycare to laundry services to food to vital documents to clinic to everything in one place. And it's really helped the community reduce crime, provide access, a one-stop shop to those in need, as the gentleman was just speaking of. We don't want anybody to fall through the cracks. And that's part of why when we made this financial investment, it wasn't just for Maryland Physicians Care. It was really to get this startup off the ground to serve the community. With that being said, we've run into similar issues in other areas where people have come and they don't have Maryland Physicians Care. So the way that that has worked out in other places, as Shelley was saying, is there's usually a navigator that can connect the constituent or the individual or the community member with different resources. And if they need insurance, they can select any of the MCOs, but still get serviced out at the hub. When it comes to Maryland Physicians Care, we have a dedicated team of social workers and community health workers for Garrett County, as well as Allegheny and statewide. And so they would be screened using the Prepare tool, which is an evidence-based tool. And then they would go into um, our our program, meaning that they would get a full evaluation. They would get food, if they qualify for the food delivery program, because we do have a food delivery program, as well as they would get support if they needed housing, or if they had housing in disrepair, or if they had, workforce development, or utilities assistance. So we do have a dedicated team that would support that for those that are Maryland Physicians Care. And if you're interested in that, we do have business cards as well as rack cards that we could drop off at any of the offices of providers that you can hand to the member, and then the members, the MPC members, can actually just get connected from there. I hope that answers your question when it comes to Maryland Physicians Care. Shelley, is there anything else that you wanted me to share?
I think that's it for now. I just wanted to, like Lorena took us to all these food projects all over the state, and it was amazing. So it gave us a vision for what the 360 Access Hub can be and what we want it to be eventually. And so we're kind of phasing in, and this is the very, very first step. And we want to do it slowly, and we want to try to do it well. And we want to make sure that we're treating each family or each person that comes in. We don't want to just have it be a real quick thing, and they're out the door, and then you see them again in 2 weeks and nothing's been solved and they're still struggling. So we want to try to invest in the people that are coming in and just begin to build. The building itself needed a lot of it needs a lot of work. The kitchen still needs a lot of work. But we decided, looking at the funding that we had, we could either spend it all in making the building super spiffy and still not have enough, or we could just start serving people. And so that's why we're utilizing volunteers to get it painted. And we're going to try to have some just different types of donation drives as we continue to serve people. Lorena?
I didn't mean to have my hand up. Sorry, I hit the wrong button.
That's okay. So it's just, it's an exciting thing. We've talked a lot about it. As I've mentioned I feel like every meeting, there are a lot of people and a lot of churches and organizations that have soup kitchens that, have very organized ways and a lot of pantries, and serve people once a month. It's still a struggle. We still have unmet need, and we still have struggles coordinating all of those different pieces. And so we thought, rather than have all the planning done ahead of time, we would just forever be stuck. So we're just starting. And those are the 3 ways we are starting off. We're certainly open and flexible to changes, to other ideas, continuing to look for funding and write more grants. And so, there's going to be, I think, the 360 Access Hub website is soft launching on Friday. So it's fairly clear as far as just, we're trying to make it simple, mobile friendly. We're trying to make it easy for people to request an appointment, for providers to request and refer. And then we'll just keep checking in. And so you have access to John and I at any time. And we just want to make sure that you guys communicate as we start you start hearing different things about it. We really want to know the feedback, and we want to try to make sure that we're doing the best that we can. So again, it's kind of spread across 3 different agencies. None of us have full-time staff well, Lorena has full-time staff to put there for Maryland Physicians Care at the 360 Access Hub. The rest of us are just doing our best to cover that. And so that's why it's by appointment. The ultimate goal is a community cafe with laundry, hygiene, all of those other things, but that's maybe a couple years down the road. So does anybody have any other questions? I don't want to take up the whole time. It's almost 9. Sorry.
No, this is great. Let's continue the discussion if anyone has questions.
Perfect.
Okay, so hearing none, we'll keep going here for a minute, and then if you have questions, you can certainly ask them as we proceed. There were a couple other things that I wanted to highlight as well that I thought were really important as part of that discussion that will kind of lead into the next part of our meeting today. So the first piece that Dr. Savopoulos brought up and Shelley talked about very excellently, I think, is this concept of sort of these ALICE populations. So this asset limited, income constrained individuals who might not qualify for different types of assistance, whether it be federal assistance, state assistance, or even local assistance. That is certainly something that we're watching very closely, and that is also a big piece of this whole project, is that it has been one of the most data-informed endeavors that I think we have ever undertaken. So really analyzing that secondary data that is part of that community health needs assessment that we reviewed in previous meetings. We sort of looked at the whole data landscape. That call is posted, it was recorded and posted on the Garrett County Health Department website. So that is available for anybody who wants to go back and kind of look at, where you might be able to find some of that information. The other piece is that we obviously we've collected quite a bit of survey data as well. There are often questions about food insecurity on many of the surveys that go out for different assessment purposes from the health department, from the local management board, several different agencies. Community Action also asks some of those questions, as do the public school system. Different individuals are constantly asking questions about that, and we consider that data. But the other piece that was really important, I think, in terms of this sort of ALICE individuals, ALICE populations with this asset limited, income constrained, is what we get from the qualitative data. So the listening sessions that we have held, we had several of those with different stakeholders. We had one that was mostly agency individuals. We had one that included a lot of farmers. We had one that included just the general public at large. Many of those calls are also posted and available, so you can go back and kind of just watch and see what comments were submitted through those. But one thing that does constantly come up is, what about the folks that fall through the cracks? And I think that with this approach of sort of blending several different services that are co-located, is that we're trying to get closer and closer to that no wrong door model, not the wrong door model, the no wrong door model, so that, realistically, if we can get them referred to this center, there's a good chance that if they actually are food insecure, that one of these 3 services will be able to hopefully kick in and help support them. And then, as Shelley mentioned, there will be additional supports. But one of the things that sort of ties into this is that this isn't sort of stagnant. As Shelley mentioned, we're not just kind of like, okay, the data said this and we're going to do this and this is what it's going to be for the next 5 years. We're also continuously monitoring and evaluating a lot of this data as well, even to the point where we're trying to put together the final website to launch this week, hopefully, as Shelley mentioned. Sort of put that clock on me, but that's okay. We agreed to that earlier. So I wanted to flip through here real quick. Let me go ahead and start screen sharing. But one thing that I do think is really important and applies not only to the work with food insecurity, but also just sort of all of these social supports. It might also be public health supports. There's a group on mygarrettcounty.com. So if you go under action groups and local data, called Garrett Guide. This is the group, the action group, that houses all of the data for the resource guide. So when people utilize the resource guide, that data gets sort of just pulled and put into here. We don't have June data available yet. That should be pulled here in the next couple of days. But one of the things that I do think is really important is that we are seeing a pretty sharp increase in the number of resources accessed. So if you see back during sort of the COVID period, really the peak COVID period, we also had a very similar increase. But there was also an increase in the number of individuals requesting resources. What is different this time between the COVID period and current is that it's pretty steady. So what this is kind of showing, and we probably need to do some more research into this, is that essentially there's not a huge increasing demand from the number of individuals requesting services, but the needs appear to actually be getting slightly greater for those who might fall into those populations that are either falling through the cracks or might already be on support services that have diminished with some of the rollbacks to care. Just something that we probably need to watch, but certainly a sharp increase that is really data driven. So now is kind of the time where we're sitting down at the health department. We're like, okay, we really need to look at what we're doing, right? Like we need to make sure we're connecting people with the resources and the care, because it's certainly much sharper than where we have been here for about the last year and a half. So that's just an important piece that I wanted to highlight. I want to go ahead and open it up one last time to any questions anyone has before we switch over to behavioral health as our focus area for the Child and Adolescent Wellness Work Group. Okay, well, oh, Fred.
Yeah, thanks, John. Yeah, I think it would be, I'd like to let people know that the local management board part of our office will be, I think we included in our community partnership agreement a benefits access role position or positions. And I think Lindsay's been working on a RFA. I think it's is that what it's called? Is Lindsay with us today?
Yep, I'm here.
Oh, is that what it's called?
Yeah, an RFA, a request for applications.
Yeah, thank you. And I think it's important, Shelley mentioned earlier that, there's a referral process, and the hope is that once we have the benefits access individuals that can be at the location, that there might be an opportunity for walk-ins to do whatever screening needs to be done, as opposed to having people do a referral. But in the beginning phases, I think that's necessary because we don't have the staff yet. And it was great that Shelley mentioned that, and that'll be published in the documents or the promotions that are coming out for the appointments are going to be needed, just to avoid people becoming, overly critical of a new initiative that's in the county that, just to let people know, has not existed, even though it's been talked about it was even talked about when I started with at the time, the Core Service Agency, and that was a little over 20 years ago. So there have been, Shelley mentioned, the churches have done wonderful jobs to their capacity. There have been other organizations that have been able to do meals every now and then, but it's been challenging, or it just hasn't existed, to have a sustainable type of food opportunity, and also to do the benefits component of that and other social support system networks or linkages that will evolve into this 360 Access Hub. So it's good to know. We're excited as the local management board and the local behavioral health authority to assist in whatever way we can to make sure that this gets promoted and utilized, not by everyone in the community. I think that's it.
Thanks, Fred. You made me think of something else. We are also working with other partners. So just because we have these 3 established to start with, I know I have a call into DSS because we have a program coming up to make sure that someone can be on site when we have an open day for just making sure that they are enrolled in SNAP and other things. And we'll do the same with WIC. And so we're certainly open to anyone else who wants to come and participate and use the hub for different things, community events, and just, I think it's just really open, and we're going to be able to just accommodate and hopefully make sure all of the agencies and everyone can use the space. So that's been something that we've all agreed to, and we all really want to see happen, that it's a really inclusive spot that's a true resource for agencies and community members alike. Thanks.
Okay, excellent. Thank you, Fred, for providing those additional details. Is there anyone else who has any questions, comments, or feedback? Okay, hearing none, we're going to go ahead and proceed. So this is going to be pretty short because this is kind of a transition month for us here. So last month, as you all remembered, we reviewed the data from the prioritization survey for this work group, really trying to figure out what we wanted to focus on as sort of the overarching topic so that we could start sort of putting together a couple projects. So we're going to continue to do the presentation series. We're going to talk about all these great topics, hopefully every month. I think that's been a really great addition, and those videos have been utilized. So that's always a good thing, is when we do things that have a lot of future utility as well. But we're just going to talk a little bit real quickly about behavioral health as a priority area. For the work group, that was what was decided through that prioritization data that was presented. And all of those resources are available on the Garrett County Health Department website. If you go under news, it says Garrett County Child and Adolescent Wellness Work Group. You can click on that and you'll be able to see this. We are also now doing this for Health Planning Council as well. I don't have the most recent Health Planning Council up yet. Beth has sent that to me, but it's a huge file and it takes a really long time to upload. But we are uploading all of these, so you'll be able to go back and watch those previous videos and then download the resources that were attached if they were made available. So you can actually go into the workgroup prioritization survey. You'll be able to see all of this data, and hopefully we'll be able to have some really good record keeping here moving forward to be able to see, you know, all of these different presentations, all these different materials. YouTube is not loading. There it is. But yeah, so that page is available as well. But with behavioral health, there's a couple of things. So we are deep into the community health improvement planning process, the planning process for the improvement plan. That's a little bit hard to say, but we are hopefully going to be embarking on that very soon. So one of the things we talked about in previous months is this really great data insight that Shelley put together. So it was specifically about mental health in the previous community health needs assessment, because that was the #1 priority, but we will certainly be going through all of these and putting together a community health improvement plan. And I think that would be a really good jumping off point for this work group, is to have really up-to-date data on behavioral health, so mental health, but also substance-related disorders, because I think there's a lot of new things kind of coming forward with that. That's continuing to advance pretty well, while some of the other health priority topics might be sort of slowing down here at the moment. But I just got a bunch of new resources from the state of Maryland, particularly around substance-related disorders, but also sort of like these like last mile resources as we're considering things like overdose and things like that. So we will be updating all of these and then sort of working towards that community health improvement plan. So that's kind of where we're at with that. I don't think we're ready yet as a work group to pick a specific project, because we just don't have all of the data really assembled around it. I also want to go in and compile all of the YRBS information, the most recent YRBS. Our Health Education and Outreach Unit always does a really great job at presenting that at DFCC and in other formats and venues. So we'll be assembling some resources to dive into behavioral health as a priority for this work group moving forward. So I just want to make sure that we just touched on that really quickly, because we had that great presentation from Shelley this month, but we're still assembling some of the pieces that we need to really, I think, be data informed and data driven in how we figure out what steps we can or should or probably need to take as it relates to mental health, particularly for child and adolescent populations in Garrett County. The other thing I wanted to mention is that the community health assessment, for anybody who wants to get a head start and kind of look through some of the data that was collected, if you go to mygarrettcounty.com, we talked about this in previous months, and there's also an extended recording talking about this. But under My Community, you can see all of the previous community health needs assessment, including the most recent one from 2025 to 2027. That is this page. This is what the current one looks like. This was just published. We talked about that not too long ago, but there's a lot of great jumping off points here if you're already really interested in behavioral health as a topic and sort of want to dive in and be better prepared for some discussions and to really engage with that topic. There is more information than any human can probably digest. Shelley and I had to put this all together, and I barely was able to read through all of it. So there's plenty of places to start if you're really wanting to do that. I know some folks were wanting to get ahead. There's some new folks on the work group. Some people are moving around at the school system and other agencies. So pretty excited for that. The last thing I wanted to mention is that. And I think Melissa was on the call. I don't know if she's still with us or not, but Melissa yesterday at the Allegheny County Local Health Improvement Coalition talked about their community health needs assessment, which I think is super exciting. They have a really phenomenal new piece of work that has come out. We've also been working with them to update Allegheny Speaks, which is Allegheny County's version of mygarrettcounty.com. So you are able to access that at AlleghenySpeaks.com. But very similarly, under My Community, you will find the Allegheny County Health Department's most recent community health needs assessment. Melissa and Carrie from the Allegheny County Health Department did an absolutely phenomenal job with this. So I just highly recommend it. And the thing that I think is really cool about this that will also be really useful for us as we start planning some of the initiatives that we might want to undertake as the work group, or also just through our general work, is that this community health needs assessment, for the first time, as long as I have worked in public health, really closely matches what we've done in Garrett County. And I think that there's a lot of utility to that, because you can kind of move across counties. We know that people move across counties, not only in Maryland, but also West Virginia and Pennsylvania. But this is a really great first step to having direct comparisons for a lot of our information, and also just process to be able to say, okay, here's what the focus groups in Garrett County said, here's what the focus groups in Allegheny County said. And also in all of the secondary data, we were able to work with that, with them on that project as well. And they just have a really cool place that I think that you should all check out if you're interested in that. If your work includes individuals from Allegheny County or people who live, work, and play in Garrett or Allegheny County, we know that people move across that border there pretty frequently, especially if you want to go to TJ Maxx or get some Chick-fil-A. So I just want to make sure that people know that that is available. And then Melissa, is there anything that you want to say about that, if you're still with us today?
I'm still here, John. Thank you for saying all that and pointing it out. And thank you and Shelley for all your help with it. I don't have anything else. You did a nice job. Thank you.
Okay, fantastic. So we are definitely excited to start using that and incorporate that in a lot of our planning activities. But that's kind of where we're at today. So with behavioral health, I think that the most important thing is that we need to keep doing some more research. We need to collect a little bit more data, and we really need to aggregate it across a couple of sources around health topics, like Shelley did in the previous community health needs assessment process. So those data insights will be a really critical piece of the community health improvement plan, but also hopefully inform our work for whatever project this work group decides to proceed with. So that is all I have today. So the last two things on the agenda are agency updates and open comment. I don't have any additional agency updates or open comments, so I'm going to open both to the group. Karen, yes.
So I know with the bill that came out, Medicaid and SNAP are mentioned in it, but I wanted to let everybody know that as of right now, WIC is okay and we are operating as usual. So if you get any concerns, still refer them to us, but as of right now, we are funded. We are not being impacted. So we are still serving our population.
Thank you, Karen. Yes, that is always important. Yes, Michael.
Hi, I'm Mike, the new Director of Student Services at Garrett County Public Schools. I am excited to be here on the team and to be working with everybody. Dr. McCartney and our superintendent and Scott Germain, our Director of Food and Nutrition, shared last night in the board meeting that with our summer feeding program, which there is a link under food and nutrition on the website, provides on average 12 to 15,000 meals a week. They've already done 20,000 so far this summer. There are 38 locations, and it's all on a federal reimbursement program. So I just wanted to put that out and to share that with all the people that everybody's concerned about, to be able to contact that, look at the website, and to be able to find some additional food resources from our school system.
Thank you, Mike. That is great news. And thank you so much for joining us. We are really glad to have you here for the Child and Adolescent Wellness Work Group.
Thank you.
Thanks. Sadie.
Oh, excuse me. It was also shared last night. Scott Germain shared that they received grant funding. All breakfast and lunch for all students starting this upcoming school year will be free. And that's amazing. I think that's going to be so beneficial to the students of Garrett County.
That is fantastic, and a great example of all of the work that it really takes to keep up with all of the changes. So not only informing our programs and projects around historical data, but also the things that are happening in real time. So thank you. That is an exciting development, and it's something that really makes my heart happy. Other updates. Okay, well, hearing none, we're going to go ahead and close out. Thank you all for coming this morning. Like I said, next month, I'm hoping to have some additional resources available so that we can start digging in a little bit more to behavioral health as sort of a priority area, but also just thinking about the resource allocation, the resource coordination piece as well. We'll definitely be looking into that and trying to figure out sort of the progression of presenters for that so that we can help really dive into that topic as well, just because we know that there is a need for that from some of the data that we have. So thank you all for coming. I hope you have a wonderful day, and we will get this posted to the health department website as soon as possible in case there's anybody who wanted to come but wasn't able to watch live. Thank you.